right, welcome to the Pediatric ICU at the Children's Hospital of Illinois in Peoria, Illinois. You can see that as we're standing in the Pediatric ICU, this is also the site of our Congenital Heart Center. So I'll just give you kind of a quick walkthrough around the unit to show you how things are laid out. So we're currently on the main hall for our Pediatric ICU. This is a 16-bed intensive care unit. It's a mixed unit where our cardiac patients are alongside our medical surgical patients. In general, the cardiac patients tend to be situated towards the front of the unit where we are now, and the medical patients get dispersed a little bit farther down towards the back of the unit. We've got room up front where our pharmacist will tend to sit. Currently nobody at the desk, but this is where the pharmacist hangs out. As we move through the unit, we've got a desk area here where the intensivists hang out with our nurse practitioners. And this is generally where they will sit and do their documentation, put in orders and so forth, where they can be easily reached by nurses and staff that need to contact them with any concerns. So as we move through the unit here, we've got a workroom where our residents and students hang out to do their notes and documentation. Our dietitian and social worker hang out in that room as well. So again, everybody compact in a nice area where it's easy to reach the team members that need to be reached at any time. Moving down through the unit, we've got some storage space here for supplies to do lines and dressing changes and things like that. And then we've got a nice open area here in the middle of the unit. And this is our main nursing station for the Peds ICU. We've got a monitor tech and the charge nurse sits here, and this is a good central location where you can see both ways down the hallway to address any emergent patient care needs that come up. Now we're reaching the back of the ICU here. So we have a few more patients' rooms on this side of the hallway, and everything to my left is still part of the Pediatric ICU. And as we walk across this kind of straight section, you can see that the unit is shaped up like a horseshoe. So ICU sides on this way, or on that hallway coming across this way. And once we get over to this side, we have a 16-bed pediatric intermediate care unit that is an open unit. Can have surgical patients, ICU patients can be over here, hospitalist patients over here. And it's a pretty similar setup to the ICU where you see 16 beds extending down towards my left down this long hallway with a nursing station again in the center where there's dedicated intermediate care unit nurses that operate on this side of the hallway.